Hi, D'Angelo?
Yep.
D'Angelo, my name's Jose. I'm a student physical therapist assistant. I'm going to be working with you today.
Sounds good.
How are you feeling?
A little sore, but feeling pretty good.
A little sore? Okay. So recently you just had that surgery. Feeling a little bit better than probably before you had the surgery, right?
Yeah.
Okay. What would you say your pain is at right now?
7.
Okay. Just kind of sitting here right now. 7 out of 10.
Yeah,
Okay.
6 or 7 around there.
Okay. So again, I'm sure the doctor has told you, but again, with that surgery, so it's a pretty major surgery on that right shoulder. So if you can think of the shoulder as kind of a ball and socket, so think of the shoulder kind of a ball that sits in this tight little socket. So what you had is you had pretty significant surgery where there were some changes going on where we had to basically take out your normal kind of ball of bone and kind of replace it with something else. So like a metal ball to help kind of stop with or inhibit the pain and things like that and get that shoulder back to normal functioning. So it's going to be a slow process, just being up front and forward, but we can definitely get that shoulder back to where it was and make sure that we're doing things in a pain-free environment. Okay.
Cool.
So I know that you're planning on going home pretty soon in terms of getting back home and trying to do the same exercises and resting out of the hospital. So today's plan is to kind of go over just some movements of the shoulder, to go over some of the limitations with and without the sling that your doctor has ordered, as well as a therapist. And then finally, to kind of just work on a couple of simple exercises that you can do to kind of help maintain some of that shoulder stability, improve and maintain some of that shoulder strength while you're recovering.
Mm-hmm.
That sound all right?
Sounds good.
Cool. All right, D'Angelo, so again, like I said, in accordance with the doctor's protocol, there are some limitations with the motion and the range with which we can take your shoulder right now. So I'll actually show you some of it, and then we'll work on doing some passive range of motion, which is going to just be done in a pain-free range, but it's kind of just still keeping that joint moving a little bit, while trying to protect your surgery site and things like that. Okay. Cool. And I know it stated in your chart that when you go home, you're actually going to be in a chair as well, kind of in terms of like sleeping laying down, because we can't yet sleep in a bed to roll on your side. So a lot of the exercises and movements we're going to do are going to try to be in a seated position, so that when you get home, you can work on doing everything from that seated position.
Cool.
Sound good?
Yep.
Okay, so what we're going to do first, I'm just going to go ahead and remove this pillow. And D'Angelo, what I want you to do is I want you to work on just slowly removing, see if you can help remove the sling on your own. I want to see how you do it. And I'm just going to help you too.
Okay.
Kind of hold and make sure.
Now to unclip that guy.
Yep. And we can actually probably just let it sit right here for now, right? Because we can keep that shoulder kind of right here. So what we're going to do, first protocol that the doctor wants us to follow is what's called internal rotation to neutral. So right now you see where your shoulder is right now. Mm-hmm. You can kind of come out to like right here. So kind of this neutral and then back. So again, if you have your sling off, this is kind of the motion that you can do in this action right here. So I'm just moving your arm, but again, this is kind of just the protocol that we don't want to break here. Okay, so that's the first one. Second one is going to a little bit of what's called external rotation, so kind of laterally rotating that shoulder out. We're only allowed a certain amount of degrees right here, okay? So it's very minimal, where I'm just passively moving this within that range. Is there any pain as I'm doing this?
No.
Okay, no pain at all.
It doesn't increase the pain.
Okay, good. So we're just gonna do this a couple times. Okay, so again, just going within the degrees of motion here. Okay, so next one we're going to do is elbow flexion, so kind of raising that, shoulder flexion, so raising that shoulder up and down. Again, we're limited with what we can do, so I'm just going to take you up and back. Any pain there or any increase in pain?
No increase.
Okay. So again, we're just let your arm, you're kind of letting me do all the work, and you're kind of just letting that arm just be nice and relaxed. Okay. Next one is kind of putting that arm out to the side, so what's called abduction, so lifting that shoulder up and out to the side. Again, we're kind of limited with what we can do here. Again, I'm just taking it through our allotted range of motion here, and again, there should be no pain with this, so just let me know if there is or increased pain. Okay, and the last one is elbow flexion. Okay, so kind of just taking that elbow back and forth. So we have a little bit more range of motion here passively. And again, let me know if there's any increase of pain with this at all. So again, we can fully work on straightening that elbow. Good. Any increase in pain there? So again, just taking that arm passively through. Good. Okay. All right. So we're gonna hold it here, and I want you to go work on work on putting that sling back. So show me how you would work on putting that back. Okay. So because again, I want you to try to show me, just because you might have to do it at home sometimes on your own. Good. Whoop, almost had it.
Not so good.
It's okay. I'll help pull her here. So you should hear us. Yep, you got it. You corrected it. Yep, so you should kind of hear that snap come in every time. Okay, so this is the motion, or this is where we want that shoulder to stay, okay?
Okay. You ready? Okay.
All right, D'Angelo, so again, we just went over the range of motion kind of parameters, and when you have the sling off, just what to be aware for in terms of what you can move and how far you can move it. And I'll be sure to send you home with a printout of like the numbers of what your limits are, but again, hopefully just showing you, knowing, okay, we can only go to here, here, and here with that shoulder. So just be cautious of that when you have the sling off at home and you're doing stuff, okay? So right now what we're gonna do is we're just gonna go through a couple different exercises, and then we're also going to kind of work on, after that, kind of some draping in terms of getting like clothes on and off with your without the sling, to make sure that we're getting your shirt on without breaking some of those shoulder precautions. Okay. So first, what we're going to do is we're going to work on getting to a seated upright position. So you're going to work on kind of turning towards me. So again, we don't have much use of that right arm, so you're really going to have to work on kind of using that left to really help push, and then using your butt and legs to kind of help just kind of wiggle your way up into the seated upright position, okay? Okay. So let's go ahead and let's try to do it. So again, no use of that right. Let's try to just make that minimal. Nice and swing over. Good. Okay, perfect. All right, D'Angelo, so the first exercise we're gonna do is called a ball squeeze, okay? So we're doing a ball squeeze, so you can have the sling on while you're doing this, and basically you're gonna grip the ball, and you're going to time yourself. So you're going to do 2 sets of 30 seconds. When you squeeze, I want you just to do a really like 20 to 40% of the max that you can squeeze. That's how hard I want you to go. Okay. Okay, so we're just doing this to kind of still maintain some of that strength in the forearm and arm muscles. So while being in the sling, we can still maintain some of that strength so that those muscles don't get disused. Okay? Okay. So you're going to go ahead and grab the ball. Okay, so I'm going to time you. What I want you to do on go, you're just going to take nice light ball squeezes. Okay? Okay. And go. Yep, so just good ball squeezes here. So again, just trying to preserve that muscle strength. You can keep going. And while you're doing it, so again, two sets of 30 seconds. I'd like you to do it twice a day. So kind of do this in the morning. And then at night, again, just making sure that we're not squeezing fully, just because we kind of want to just keep it a little bit sub-maximal for now, until your shoulder starts to heal up a little bit more, then we can start to be a little bit more aggressive. Okay. Okay? And we'll stop there. How'd that feel? Any pain or anything? Nope. Okay, good. All right, so I'll give you this to go home as well. So the second exercise is what's called a scapular retraction. So basically what we're doing is we're going to still work on, so the scap retraction helps to kind of promote shoulder stabilization. So we're really working on, I'll show you from the side. So you're basically bringing your scap kind of back into you. So you should kind of feel your shoulder blades pinching a little bit against you, and then you're coming back to that neutral position. So you're kind of pinning your shoulders back, and then coming back to a neutral position. So you can do this right in standing. Yep, so we're just kind of do this to kind of create that good posture and to really work on strengthening some of those shoulder, back shoulder muscles here. Yep, good. So kind of you should feel that pinching into my hand. Good. Any pain while you're doing this?
A little bit, but not too much.
A little bit. Where is it? Just more in that incision site?
Yeah.
Okay. All right. So we'll still do 2 sets of 10. Same thing. Okay. So start in the morning, do 2 sets, and then later in the evening we'll do 2 sets of 10 as well.
Okay.
Okay. But again, nice and controlled, right? So we're not going you don't need to go any faster than you're going now. And again, it's just really work on creating that good scapular stabilization while that shoulder recovers.
Cool.
Any questions on that one?
Nope.
Okay, so the third one that I want you to work on is what's called isometrics. So we're going to do some biceps isometrics. So what that means is the arm actually isn't moving at all. So you're actually still, we're getting some muscle contraction without the arm or elbow even moving at all. So what you're going to do is you're going to place your left hand kind of over your right, just right on top of that. And what you're going to do is you're going to try to push your right arm up into your left hand, okay? But you're basically not moving that arm at all. So basically this left hand is kind of stopping your arm from coming up like this. Okay, so you're applying the equal amount of pressure as the right arm is trying to come up with, okay? So what you're going to do is you're going to do that in terms of pulling up. I want you to try to go at, like, again, 20 to 40% of the max that you can contract that biceps at. Because again, we just want to keep it very light. Okay, so when you do this, I want you to hold it for like 6 seconds. So you're going to go hold 3, 4, 5, 6, and then take a little break. Okay, then same thing, press into the hand, hold 2, 3, 4, 5, 6, and take a little break. So go ahead and try it.
1, 2, 3, 4, 5, 6.
Good, take a little break.
And again?
Yep.
1, 2, 3, 4.
Feel that biceps, you get,
6.
yep. So again, we're working on keeping that bicep still active and still maintaining its strength without moving that arm. So this is a really good exercise to not move any of the shoulder actively, but still work on strengthening the muscles around it. So for this one, I want you to really just work on 1 set in the morning. So 1 set of 10, and remember 6-second hold. Take a little break, again, very light, sub-max, and then do it once again in the evening. So 1 set of 10. Again, very light, don't push past anything in terms of pain or anything like that. So for all these exercises, there should be no pain. So just moving that pain-free range. Any questions with those exercises?
Nope.
Okay, perfect. All right, D'Angelo, so now what we're gonna work on is we're gonna work on, like I discussed, getting shirts and like clothing on and off, just because again, once you get discharged home, it's a good skill to have because you're gonna have to take your sling off. And so it's kind of good that we can work on getting our shirt on and off without breaking some of those shoulder precautions, okay? So remember the precautions I told you. So remember, as soon as you take that sling off, work on trying your best to kind of keep that shoulder in its place here, because we're not really allowed any active motion of that shoulder. So as soon as you kind of take it off, really work on just holding it. We'll just kind of keep it here, okay? Cool. All right, so I want to see, first I want you to do is I want you to work on taking the sling off, and then once the sling's off, we'll work on taking the shirt off while having the shoulder stay where it is, okay?
Right. Cool.
Okay, yep, so remember, yep, keep that nice and tight in, good. And what you can also do while you're doing this, if you need to, and again, you shouldn't need it, but if you need it, we can always place a pillow underneath here.
Okay.
While you kind of rest and recover, like you kind of stack a pillow up. So, but again, let's see, kind of work that shirt off. Again, keeping that arm nice and controlled there. Ooh. Good. Try to keep it.
Oh no, I got stuck here.
It's okay. You got it, yep. So you kind of want to lead through that left first, Yep, because now you can work on just slowly letting that arm
There we
drop.
go.
Yep. Okay. So now remember, on the way getting that shirt back on, you kind of want to promote going up the left first and getting that left on, right? Because the left might not be able to help get the right on.
Okay.
So you can do it both ways. Is there a way that you feel more comfortable with going up the left or the right?
Probably up the left first.
Okay. Yep. So again, remember, really work on trying to not rotate that arm too far out. Yep, keep it right there. Yeah, don't go too high, right? There you go.
Walked in the wrong hole.
It's okay.
Wait, no, I didn't. It was that way.
It's okay. Oh, whew. I'd rather you at least keep your shoulder within the same parameters, and even if the shirt gets down a little bit awkward, maybe if it's backwards or forwards, I'd rather have that than have you try to break the shoulder precaution to get that shirt on. There you go. Yep, keep that shoulder nice and tight. Good. Get any pain with doing this at all?
Very little.
Okay.
Next time I wear a loser shirt.
It's okay. Yeah, no, it's all right. All right. So,
All right, we're in.
okay, so now I want you to show me getting that sling back on. So remember, keep that shoulder where it is, and let's work on getting that sling back in on your own. Yep, so remember that'll slide in nice and easily. Good. There you go. Good. Yep, so remember that front clip. Good. Yep, and then we'll just do the last two. Okay, good. So now that you've seen how to do it, just remember, whenever you're getting your shirt on and off, even with getting maybe sometimes pants on and off, just remember to try to keep that shoulder in that best stable position. Kind of just imagine every time you take the sling off that the sling is still on. Because that'll kind of just give you a good visual cue to say, okay, as soon as I take the sling off, I should think that it's still on, so I know that I'm not breaking any of those shoulder precautions.
Okay.
And again, just because you did it in seated, you can do the same thing in standing. So again, if you stand up into it, you can still do the same thing, but just remember the same precautions apply.
Okay.
Any questions with that in terms of best management?
I don't think so.
Okay, cool. Okay. All right, D'Angelo, so I know we did a lot today. So again, just quickly, just gonna recap some of the main points, just so that we're ready once you go home, that you're following all the proper protocols and restrictions per the protocol after your surgery. So just remember with that shoulder, so we'll actually demonstrate with your left just because the slings are already on your right. So some of the motions we can do. So you actively, so kind of on your own volition, you can kind of bring your elbow up and all the way down. So I don't want you to go up all the way. You can kind of come up to like right about, right about there, and then you can extend it all the way down. Yep, nice and up. Good. Yeah. So you can do that. Okay. So that there's no MD has no problem with you doing that. And then anything in the wrist, totally fine. So any of your wrist movement, you can do as much of that as you want.
Okay.
Remember with the shoulder movements, nothing really actively. So nothing that you can do on your own in that shoulder. So that shoulder kind of, as soon as you take the sling off, it has to really stay here. Anything that we do with that shoulder as of right now is going to be done passively. So by myself or by the physical therapist. Okay. So just making sure that we maintain that. Okay. In terms of the exercises, so if you remember the exercises that we went over, so remember the ball squeezes. I'll give you the ball squeeze on the way, or for home. So remember, just light squeezes, nothing too crazy with the super strong contraction, nice and light. Just working on maintaining our forearm and arm strength as you recover. Okay, and then remember the retractions. So remember, kind of working on pinning those shoulder blades back and forth. Again, just really working on that good shoulder stability. So again, I kind of listed the reps and sets as well as a picture of how to do those.
Okay.
And then finally, remember the arm isometric. So remember, in the sling, having your left hand here, kind of controlling and kind of pushing nice and light for like six seconds. Just doing it very briefly. Again, just trying to maintain that bicep strength as we recover.
Okay.
So again, same thing. I wrote down all the instructions as well as a picture just to kind of show, again, twice daily. Everything of those exercises and pain-free. Okay. And then finally, just be sure we're using ice after these exercises. So again, ice can go over that shoulder.
Okay.
Do you have like ice at home, like ice cubes and stuff like that? Okay, so what you can do is you can just do ice cubes in a plastic bag and just kind of just place that right over your shoulder.
Okay.
You can do it with or without a shirt on, shouldn't matter. But again, ice is really good for your stage right now just because you have it's pretty heavily inflamed.
Mm-hmm.
And so ice will really help kind of calm that down as well as help with some of that pain. Okay, so again, 10 to 15 minutes, put it on. Again, once you take it off, just check your skin. It's okay to have some normal like redness after after taking off the ice. That's normal. If you see anything like any redness with that's like raised, so it's kind of elevated off of the shoulder, so any kind of raised red spots or like red patches, just let me know, because that may be something we need to modify in terms of that modality. But other than that, just do the ice. I would say maybe twice as well, as you see fit, no more than twice a day. But again, 10 to 15 minutes. Other than that, do you have any questions for me as you start to kind of make your transition on the way home?
I don't think so.
Okay, perfect. So again, I'll give you these and then we'll follow up with you soon, and we'll start to work on the home health stuff and make sure that we're progressing the shoulder as is.
Okay.
All right.
Sounds good.
Perfect. Well, we'll see you then next time.
Yep, that's good.